This is the human heart, a biological engine that beats 100,000 times a day.
To function, the heart needs its own fuel supply. These are the coronary arteries.
But over decades, cholesterol, fat, and calcium build up on the artery walls. This is plaque. It slowly narrows the...
When the plaque ruptures, a blood clot forms instantly. In seconds, the artery is completely blocked.
Starved of oxygen, the heart muscle begins to die. This is a myocardial infarction.
The patient is wheeled into the operating theater. A team of highly trained specialists, surgeons.
First, general anesthesia is administered. The patient falls into a deep, controlled sleep.
Sterility is critical. The chest is scrubbed with antiseptic solution to kill bacteria on the skin, creating a sterile field for the incision. The surgeon makes a midline incision down the center of the chest. This is the gateway to the rib cage and the heart hidden beneath it.
To reach the heart, we must get past the armor. A sternum saw is used to carefully divide the breastbone, splitting the rib cage in half.
A retractor is placed to hold the chest open. By slowly cranking it wide, the surgeon creates a window into the thoracic cavity. The heart sits inside a tough, protective sac called the pericardium. This fibrous layer is carefully...
There it is, the engine room. We can clearly see the blocked arteries on the surface, but we cannot fix them while the heart is moving this fast.
To bypass the blockage, we need a new tube. Often, surgeons harvest the saphenous vein from the patient's own. The vein is carefully removed. The surgeon trims off the side branches to make it leak-proof. This vessel will become the new highway for blood flow. Trying to sew a tiny vein onto a rapidly beating heart is impossible. Enter the heart-lung machine. This incredible device will temporarily take over the job of both the heart and the lungs during the surgery.
Tubes called cannulas are inserted into the body's main artery and vein. These will divert the blood flow away from the heart and into the machine.
Once activated, the machine drains oxygen-poor blood from the body before it enters the heart. The heart is effectively bypassed.
Outside the body, the machine filters the blood, removes carbon dioxide, and adds fresh oxygen, just like your lungs would do.
Now, a cold potassium solution called cardioplegia is injected. This shock freezes the muscle activity. The heart stops beating instantly.
Silence. The patient has no heartbeat. In any other situation, this would mean death. But here, it means we have a stable canvas to work on.
The surgeon locates the blockage. To fix it, we don't remove the clog. Instead, we find a healthy spot just past the blockage to attach our new pipe.
A tiny incision is made in the artery. This hole is only a few millimeters wide. It must be perfect.
This is the anastomosis, the connection. The surgeon begins sewing the harvested vein onto the coronary artery using a thread finer than human hair.
The surgeon uses a continuous running stitch. Every loop must be tight. Even a microscopic gap could cause a fatal leak when the pressure returns.
The bottom connection is done. The bypass graft is now securely attached to the artery, just past the blockage. Now for the top end. We need a source of high-pressure blood. A small hole is punched into the aorta, the body's main pipeline. The other end of the vein is sewn into the aorta. We have effectively built a bridge that jumps right over the blockage. This is the bypass. Blood can now flow freely from the aorta through the new graft.
Before we restart flow, we must remove every trapped air bubble. Even a tiny bubble traveling to the brain could cause a massive stroke.
The repair is done. The heart-lung machine begins to warm the blood, raising the patient's body temperature back to normal to wake up the muscle. The cross clamp is removed. Warm, oxygenated blood rushes back into the coronary arteries and through our new bypass graft.
The heart often quivers when it wakes up. We apply a small electrical shock directly to the organ to reset the electrical rhythm. There it is, sinus rhythm. The engine has restarted. The heart is now beating on its own, powered by the new blood supply.
The surgeon slowly reduces the flow of the machine. The heart takes the load back, pumping blood to the body under its own power. The large cannulas are removed. The entry holes in the aorta and heart are cinched tight with purse-string sutures to prevent any bleeding.
To close the rib cage, stainless steel wires are threaded through the sternum.
They are twisted tight to fuse the bone back together, providing solid protection. Finally, the muscle and skin are closed in layers. We use dissolvable stitches hidden under the skin for a clean, cosmetic result.
The patient is immediately transferred to the intensive care unit. Here, one-on-one nursing ensures stability during the critical first hours.
As anesthesia wears off, the breathing tube is removed. The patient takes their first breath with a repaired heart. The engine is running smooth. Chest tubes remain in place for a day or two to drain excess fluid from around the heart and lungs, preventing dangerous pressure buildup.
Believe it or not, within 24 hours, the patient is encouraged to stand and walk. Early movement prevents blood clots and pneumonia.
While the heart heals quickly, the breastbone takes time. It takes about 6 to 8 weeks for the sternum to fuse back together completely. Usually within 5 to 7 days, the patient is discharged. They leave the hospital with a restructured heart and a second chance at life.
The vertical scar is often called the zipper. While it fades over time, it remains a permanent reminder. But the work isn't over. Patients must take blood thinners and statins to prevent new clots from forming inside the new graft.
Cardiac rehab is crucial. Under strict monitoring, the patient exercises to retrain the heart muscle, making it more efficient and resilient.
Surgery fixes the plumbing, but it doesn't cure the disease. Without a strict diet change, the new graft can get blocked just like the old artery. Many ask, why not just use a stent? A stent is a small metal mesh tube inserted through the wrist to prop the artery open. It works well for simple blockages. It pushes the plaque aside and holds the vessel open like a scaffold. No chest incision needed. But stents have limits. If a patient has triple vessel disease, meaning blockages in 3 or more arteries, stents are often not enough.
Think of it this way. A stent clears a traffic jam on an old, damaged road. A bypass builds a completely new superhighway around it.
For severe cases, bypass surgery is the gold standard. It generally lasts longer and offers a better
However, CABG is not a magic bullet. It is an invasive, major open heart procedure, and it comes with significant...
The biggest fear is stroke. During surgery, clamping the aorta can knock loose tine debris.
Infection is another enemy. Since the bone was cut, deep sternal wound infections can occur. These are rare but can be devastating and hard to treat.
Some patients experience pump head, a mental fog or memory loss after being on the heart-lung machine.
Recovering isn't just physical. Up to 20% of bypass patients suffer from severe depression after surgery.
Technology is changing the game. Robotic systems, like the Da Vinci, allow surgeons to operate.
The surgeon doesn't even stand over the patient. They sit at a console, controlling the robot's instruments like a pilot flying a plane.
Next. With robotics, we don't always need to crack the chest open. We can perform keyhole surgery through tiny incisions. We can also avoid the heart-lung machine entirely. This is off-pump surgery. Using a stabilizer, we hold a small... By keeping the heart beating and avoiding the machine, we significantly lower the risk of stroke and pump head.
It is a war inside your blood. LDL cholesterol deposits trash on your artery walls, while HDL acts. High blood pressure is the silent accomplice. It pounds against the artery walls, creating microscopic cracks where plaque can easily get stuck.
Smoking introduces thousands of toxins. It damages the lining of the vessels and causes them to spasm and tighten, cutting off oxygen.
Chronic stress floods the body with cortisol. This keeps the heart working at maximum RPM constantly, wearing out the engine prematurely.
But there is hope. With aggressive diet changes and medication, we can actually stop plaque growth and, in some cases, even shrink it.
The true success of the surgery isn't just a beating heart. It's the life that follows.
Coronary artery bypass grafting doesn't make you immortal, but it buys you time.
It is a testament to human ingenuity, that we can stop the very engine of life, repair it, and restart it again. Take care of your heart so it can take care of you. Thank you for watching this journey inside the human body.
If you found this animation fascinating, hit the like button. Comment below. What surgery should we explain next? Brain or kidney? See you in the next one.